In the silence of being alone, your heart suddenly betrays you, but in that terrifying moment, you possess 5 actions that stand between survival and catastrophe. When the crushing pressure begins in your chest and you realize that something catastrophic is happening to your heart, every instinct in your body will urge you to lie down, to seek the comfort of horizontal rest, to curl into yourself as if making your body smaller might somehow contain the crisis. This instinct, though deeply human and entirely understandable, works against the very mechanics your struggling heart needs in this moment. You must override this impulse and instead find a way to sit upright or position yourself in a semi-reclined state, and the reasoning behind this action reveals something elegant about how gravity and circulation interact within your body. When you're lying flat, your heart must work against gravity to pump blood throughout your entire body, maintaining pressure and flow to your brain, your organs, your extremities. This represents a significant workload for a muscle that's already in crisis, already receiving insufficient oxygen through blocked coronary arteries, already struggling with each contraction. By sitting upright or reclining at an angle, imagine yourself in a comfortable chair or propped against pillows on a couch, you fundamentally change the physics of circulation. Gravity becomes your ally rather than your adversary. The blood returning from your lower body moves more easily back toward your heart without requiring as much muscular force to pull it upward. The distribution of blood throughout your system shifts in a way that reduces the demand placed on your compromised cardiac muscle. Think of your heart in this moment as a tired worker trying to lift heavy loads up a steep hill. By sitting upright, you're essentially reducing the incline of that hill, making every contraction slightly easier, every heartbeat slightly less demanding. This isn't about comfort, though you should seek whatever comfort is possible within this upright position. This is about biomechanics, about understanding that position matters profoundly when an organ is fighting for survival, about giving your heart every possible advantage when each beat might mean the difference between muscle that recovers and muscle that dies. The aspirin sitting in your medicine cabinet represents one of the most powerful tools at your disposal during a heart attack, but only if you understand precisely how to use it in these critical moments. You need regular aspirin, not the coated kind designed for easy swallowing, not the extra-strength formulation meant for severe headaches, but standard aspirin totaling 300 to 325 milligrams. This typically means 4 of the low-dose 81 milligram tablets that many people over 60 take daily for heart health, or a single regular-strength tablet. But here's where the method becomes as important as the medication itself. You must chew these tablets thoroughly, crushing them between your teeth, letting the bitter powder mix with your saliva, allowing it to coat the inside of your mouth before swallowing. The reason for chewing rather than swallowing whole connects directly to how desperately your body needs this medication to work quickly. When you chew aspirin, you're creating immediate contact between the active ingredient and the rich network of blood vessels that line your mouth, your cheeks, the tissue under your tongue. These vessels can absorb the medication directly into your bloodstream, bypassing your digestive system entirely. This means the aspirin begins working within 5 to 10 minutes rather than the 30 minutes or more it would take if you swallowed it whole and waited for your stomach to break it down, for your intestines to absorb it, for it to travel through your liver before finally reaching your bloodstream. During those 20 extra minutes of waiting, hundreds of thousands of heart muscle cells could die. What aspirin does at the molecular level is interfere with platelets, those tiny cellular fragments in your blood that normally help form clots when you're injured. During a heart attack, platelets are clustering around the ruptured plaque in your coronary artery, making the blockage worse, choking off what little blood flow remains to your starving heart muscle. By inhibiting these platelets immediately through chewing, you're giving your blood a fighting chance to squeeze through that narrowed passage. The moment you recognize that you're experiencing a heart attack while alone, you must fight through the fog of pain and fear to reach for your phone and dial emergency services. But this action represents only the first half of a 2-part sequence that many people tragically fail to complete. When the dispatcher answers, you must clearly state your address, explain that you believe you're having a heart attack, and describe your symptoms with whatever clarity you can muster through the chest pressure and breathlessness. The dispatcher will want to keep you on the line, will ask you questions, will try to provide reassurance and instruction, and all of this is valuable. But once you've conveyed the essential information and help is confirmed to be on the way, if you have any physical capacity remaining, you must do something that might seem trivial compared to the medical emergency unfolding in your chest. You must unlock your front door. This single action, this simple turning of a deadbolt or twisting of a doorknob, can mean the difference between paramedics reaching you within seconds of arrival and precious minutes being wasted as they are forced to break through barriers you've erected for your own security. Consider what happens when emergency responders arrive at a locked home where someone inside is having a heart attack. They cannot simply wait politely at the door. They must find a way in, which means breaking windows, forcing locks, kicking down doors, shouting and searching while you sit inside, possibly losing consciousness, your heart muscle continuing to die with each passing second. Every moment they spend trying to gain entry is a moment stolen from treatment, from the administration of medications, from the assessment that determines whether you need immediate transport or advanced intervention right there in your home. Walk to that door if you can manage it, unlock it, then return immediately to your seated position. Don't prop it open in a way that compromises your security unnecessarily, but ensure that when those paramedics arrive carrying their equipment and their expertise, nothing stands between them and your survival except the few steps from your door to where you're sitting. In the terrifying minutes after a heart attack begins, your body's natural response is to flood your system with adrenaline and cortisol, those ancient stress hormones designed to prepare you for fight or flight, for running from predators or battling threats. Your breathing becomes rapid and shallow, your heart rate accelerates, and while these responses served our ancestors well when facing physical dangers, they work against you when the danger is internal, when your heart muscle is already starving for oxygen. This is why you must consciously take control of your breathing, transforming it from an automatic panic response into a deliberate therapeutic intervention. Breathe in slowly through your nose if possible, counting to 4 or 5, feeling your lungs expand fully, your diaphragm descending, your ribcage opening. Then exhale just as slowly, releasing the air in a controlled stream, emptying your lungs completely before beginning the cycle again. What you're accomplishing with this deliberate breathing pattern operates on multiple physiological levels simultaneously. First, you're maximizing the oxygen content in your blood with each breath. Deep, full inhalations allow your lungs to fill completely, creating the greatest possible surface area for oxygen to transfer from air into your bloodstream. This oxygen-rich blood, even though it's reaching your heart muscle through partially blocked arteries, carries the maximum possible oxygen molecules to those struggling cells. Second, and perhaps equally important, slow breathing activates your parasympathetic nervous system, that counterbalancing force to the stress response that promotes calm, rest, and physiological stability. When you breathe slowly and deeply, you're sending a signal to your brain that despite the crisis, panic serves no purpose here, that your body should reduce its production of stress hormones that would otherwise make your heart beat faster and work harder. Think of this controlled breathing as a conversation with your own biology, a way of telling your frightened body that survival depends not on speed but on efficiency, not on panic but on measured response, not on the rapid shallow gasps of fear but on the deep steady rhythm of someone who understands that each breath is medicine. Among the most dangerous myths that circulate about heart attack survival is the idea that you can somehow restart or regulate your failing heart through forceful coughing, vigorous chest compression with your own hands, or other aggressive self-interventions that promise to keep blood flowing or restore normal rhythm. These techniques, often shared on social media or passed along with the best of intentions by well-meaning friends, fundamentally misunderstand what's happening inside your chest during a heart attack and can transform a survivable crisis into a fatal one. The crucial distinction that most people miss is this: during a heart attack, your heart has not stopped beating. It's still contracting, still pumping, still maintaining its electrical rhythm. The problem isn't that your heart has ceased functioning but that a portion of it is dying from lack of oxygen because a coronary artery has become blocked. When you cough forcefully or attempt to compress your own chest, you dramatically increase the work your heart must perform at precisely the moment when it has the least capacity to handle additional demands. Each forceful cough spikes your blood pressure, increases oxygen consumption by your heart muscle, and creates mechanical stress on tissue that's already compromised and vulnerable. Even more dangerous, these aggressive interventions can trigger abnormal heart rhythms, those chaotic electrical patterns called arrhythmias that can kill you faster than the blockage itself. Your heart's electrical system during a heart attack exists in a precarious state, like a power grid during a storm, vulnerable to surges and disruptions. Violent physical interventions can push that unstable electrical system into ventricular fibrillation or other lethal rhythms where the heart stops pumping effectively altogether. What your heart needs in this moment is not stimulation but protection, not aggression but gentleness, not your amateur intervention but your intelligent restraint. Remain as still as possible in your seated position, conserve your energy, minimize your movements to only those essential actions we've discussed. Your job isn't to fix your heart through force but to preserve it through wisdom, to keep it working with minimal stress until professionals arrive with the tools and knowledge to address the blockage.